The hardest moments that I've ever had in RICU were during this pandemic. You sometimes don't realize how crucial something is until it's not there anymore, and not having families at the bedside to support their loved ones and seeing the impact of that on both the patient and their loved one firsthand on either video calls or phone calls was devastating. And there were young patients, older patients, many patients that last said goodbye to their partner, their sister, their brother over an iPad. I remember one scenario where, easily for 6 hours, she was over video communicating to her comatose husband. And that's just something we'd never witnessed before. Those moments that are just so devastating, incredible grief, but just not really being able to express it, either by not being there or giving a hug, or so that's kind of where we as healthcare providers did what we could to have that role, but it was, to say grossly inadequate is even an understatement. So
somehow it brought us, or myself as a provider, closer to families than I think I have been in a lot of previous patient encounters or touches. And because family members couldn't be there, they would just pour their heart out to you over the phone. You'd spend hours on the phone with them, and then at the end of the day, it almost felt like you were more connected with the patient and with the family than you had been previously when you would engage with them, face to face. And then, like you said, it almost felt more personal.
My strongest memories, both positive and negative, are kind of witnessing. I remember the first time extubating a patient with COVID, meaning removing the breathing tube, and having the family on video, including 2 young children. And, the patient himself was still very kind of stuporous and confused, but I just remember their little voices. And looking at their father and probably not understanding how close that moment came to not happening. And it's always easy to put yourself in the shoes of your patients, but having young children and witnessing those moments was difficult.
But when you mentioned that there was a woman who gave birth who was on a ventilator.
I can't talk about that. There were a few cases that were, miraculous, just inspiring, just, the reason why you thought medicine was a good idea to begin with. And that was one of them. When you want, it's important that people get a win once in a while, and having a patient with ARDS and COVID who was 3rd trimester pregnancy, and being concerned not for one person but for 2 people, and just knowing that both people had to do well, praying that both people would do well, and then to get a win like that, and for both of them to do extremely well, was important for all of the staff. I'll never forget the cry and the applause in the ICU.
when both mom and baby did well.
You know, if you saw it on television, you wouldn't believe something like that could be real. That it would just be television drama. But it was real life.
So I just don't think it comes down to one moment. It's this constant tug and pull of like triumphs of getting one patient off a ventilator and breathing on their own, and the happiness you experience with their family to just walking into this next room and witnessing a death, and the devastation that brings on the family. I think I will remember the range of emotions I can feel in a single day. That's always there in intensive care, but the amplitude was turned up with a disease that struck with no warning. I will remember sort of vacillating between those emotions, but overall being proud the way healthcare has approached it, and always kind of wanting to do it better, I think is the way I will think about it.